here just to. All right, let's go ahead and get started. I'm not going to hold this meeting up for one council member. With that said, good morning and welcome to the Glendale City Council special voting. Actually, this will not be a voting meeting. This meeting is called to order, or we're going to go ahead and call for attendance. Councilmember Aldama.
Present.
Councilmember Clark.
Here.
Councilmember Hugh.
Here.
Councilmember Tomachoff.
Here.
Councilmember Turner. Vice Mayor is not. Vice Mayor just walked in. Are you here, sir? Just holler here.
Here.
Okay, so we do have a quorum. Everybody is present. Our item on our agenda today, the first item is going to be our Pledge of Allegiance. If everyone please stand, join with me in our Pledge of Allegiance. Gentlemen, if you're wearing hats, if appropriate, if you'd remove those. Thank you. Okay. I would like to make everybody aware that this meeting is being televised live on the City of Glendale's Facebook and YouTube pages, as well as Glendale's own Channel 11. Our meetings have moved from City Hall council chambers at City Hall, where we would all be in one room. The Glendale Civic Center is much larger. We're able to accommodate people, keep the social distancing, the CDC guidelines. And those of you in the audience seated next door, you do have a screen in your room which gives you a live view of us in this room, as well as you can hear us. We also have a screen in our room that we can see you. So if you've submitted a speaker card and indicated you wish to speak on the agenda item, I'll allow you the time to make your way to this room and a podium to speak at the proper time. We have apparently 4 people, so we'll be allowing 5 minutes, up to 5 minutes for each speaker if necessary. I'd also like you to be aware that those of us in this room have a screen, and again, we can see the members next door. Please be patient. Thank you for your patience. With that said, I'd like to make everyone aware that there will be no voting again today on any resolutions. My purpose in calling this meeting was to allow the public process to occur. This is the only public forum that I can legally use to have a public discussion with this council without violating state open meeting laws. And I understand that each of you have very strong ties to your residents of your districts that you represent. And when I issued the local emergency proclamation on March 18, 2020, I took on the responsibility and the authority over public policy. The proclamation also activated our emergency management team, who has taken the necessary steps to protect our employees, our facilities, and the public. This forum also allows the council to ask questions of emergency management team, and this team is made up of city staff who are well qualified, expertly trained at a national level in handling crisis situations in an organized and a strategic fashion. I am maintaining social distance. I'm well over 6 feet. I'm taking this mask off because I can't breathe, but so with that said, Ms. Rabin, will you please introduce item number 1?
Item 1, consideration and action regarding public health practices associated with the City of Glendale emergency proclamation as it pertains to COVID-19.
Good morning, Mayor, members of the council. I've asked Deputy City Manager Rick St. John, who oversees our public safety and including operations component, to help provide the presentation today, and he has others here to assist him as well. So, Rick?
Good morning, mayors, members of the council. I am your operations chief for the COVID-19 incident management team, here to talk today about face coverings within our city. With me today is Jeff McMinamy. He's a deputy chief in the fire department, and he is our emergency manager. And then Nicole Munson is our emergency management coordinator in the city. The first couple of slides I want to go over are what the governor shared with the state on June 17th in his press conference at 3 p.m. I think it's important to talk about these numbers publicly as we engage in this conversation as a local municipality. The first slide shows COVID-like illness against basic flu-like illness and the trends that we've seen since the state reopened on May 15th. And as you can see, both are trending upward, although over the last week or so there seems to be a flattening of COVID-like illness. This is a slide that demonstrates the number of cases by day within the state of Arizona. Clearly you can see an upward trend continuing after the state opened up and anticipated to continue unless actions are taken to, again, flatten the curve. More important than the number of cases, because testing and the number of tests that are administered daily can have an impact on that positive rate, are the percentage of positive tests. And this is what your incident management team has been tracking and really paying attention to since probably about early April. We saw some trends in early April going into May, and then when the state reopened on May 15th, we started to see an increase. We anticipated a spike. We knew this was coming. What we didn't anticipate is that it would continue to spike up to 16% of tests coming back positive. I think the average daily growth rate as reported today in Maricopa County was over 8%. We had been seeing less than 5% as a steady norm, and now we're over 8%.
Councilmember Aldama.
Do you have a question, or are you just letting us know you're there?
Mayor, I was disconnected and just came back in the meeting. Thank you.
All right, very good. Thank you.
To continue, this next slide is a clip of Executive Order 2020-40 issued by the governor on June 17th. Paragraph 4 gives cities, counties, municipalities the ability to mandate the wearing of face masks in public spaces or face coverings in public spaces. To date, other Valley cities have already taken some action and issued proclamations. Avondale, Gilbert, Scottsdale, Tempe, and Tolleson have all issued proclamations. Their proclamations are very similar in nature. There are some minor differences in these proclamations. One minor difference, Avondale, for example, has an exemption for children 2 and under. Many of the other municipalities raised that age to 6 and under. Other than that, there are some basic differences that really don't impact the nature of the proclamation. Other counties and towns in the state have also issued proclamations, Tucson and Yuma County being the big two. We have taken some internal action as a result of the numbers shown by the governor on June 17th. Starting Monday, this coming Monday, June 22nd, all employees in our city facilities will be required to wear face coverings when they're in common areas and when social distancing is not, you're not able to do social distancing, physical distancing, that 6-foot rule. Then some examples that we've given of these common areas are break rooms, meeting rooms, hallways, bathrooms, anywhere where you're likely to have close contact for 10 minutes or more within 6 feet of another employee or person that's come to do business in one of our city facilities. And then, of course, we're continuing to push physical distancing and the recommended hygiene practices that the CDC has been talking about since this began. And with that, we'll open it up for any comments you may have.
All
Mayor,
right, with the council. Councilmember Tomchoff?
thank you. My first question is, has the emergency ops team, do you have a recommendation?
Mayor, Councilmember Tommelchoff, it is the recommendation that the city take action to flatten the curve. That action could include the mandatory wearing of face coverings in public spaces.
Thank you. Mayor, I have a follow-up question.
Go ahead.
I thought that I saw somewhere that unless a city takes action, that food service workers will also not be required. Servers and people in restaurants preparing food and handling food will not be required to wear a face mask. Is that true? Without city action?
Mayor, members of the council, Councilmember Tommelchoff, I believe the governor's executive order mandates food servers to
It was a
wear face coverings.
recommendation. I think it was
Is it
just
a recommendation?
I believe so. In order to mandate it, I believe the cities need to take action. We can, somebody might want to check on that, but that's the way I understood it.
Mr. Lee?
Mayor, Councilmember Tommelchoff, the executive order that was released this week goes back to encouraging businesses to follow the requirements in Executive Order 2036, which is the stay healthy, return smarter, return stronger. And in that executive order, it does not talk about requiring masks. It talks about some of the CDC guidelines. But it does also require these businesses to follow current CDC guidelines. So if it's in the CDC guidelines, then they would be required to wear masks.
Okay, thank you.
Could you see if in fact that it is in? But I think it's going to come down to basically our decision as a city what we're going to require or not require.
Mayor?
Go ahead.
Yeah, thank you, Mayor. I'm going to go ahead and make some comments now, should I be disconnected. So I want to go out and say this. So in areas 85301, 02, and 03 have had a significant confirmed cases of COVID. So it makes all the sense in the world for the city to work towards some type of mandate that that assures that we are flattening the curve by wearing our face masks. I do at every meeting, City Hall, and out and about. So it makes perfect sense. My only concern is that the resolution before us is very vague and doesn't have any details.
Mr. Aldama, I want to stop you there. We're not doing a resolution, sir. This is discussion.
I'm sorry, go ahead.
This is going to be for discussion. The resolution is not part of this today.
So then
It's posted.
that's even better, Mayor. I can stand with the council. Should we implement some type of assurance or mandate that we wear masks? It makes all the sense in the world. I, for one, am not a council member that wants to be big brother city government. However, there's a reason here to do this. We can't afford another shutdown. Businesses that barely made it the first shutdown won't make it the second time. So I think this helps in that for business owners, but for our community. Thank you, Mayor.
Thank you.
Yeah, with regard to the resolution, for the sake of transparency, because there is a resolution posted, so I think people should understand why it was posted and why we're not addressing it, because it's part of what's posted for the meeting today.
I understand that, and feedback that I received is people weren't comfortable on a vote on a resolution. Resolution was simply a postcard recommending. I take sole responsibility for the actions as far as what we will do. And so rather than asking for a vote of the council, we simply would like all of your inputs and all your thoughts.
Okay,
But this is not about the resolution.
right, okay, I just wanted, because it was mentioned and it's posted, I just
Understand.
wanted to make sure we were transparent there. I did want to, one of the things, the resolution, I thought, first of all, it was unnecessary because the charter's quite clear where the responsibility lies, but, and that is with the mayor. but it said in public places, and I disagree with generalizing if we were going to mandate face coverings, saying public places is that when somebody goes out to walk their dog or ride their bike or go hiking, walk to their mailbox, that is, you know, I just totally disagree with that. I feel if we're going to mandate face masks, it should be in places of a public accommodation, retail stores, restaurants, places like that, even private businesses where there's attorneys' offices, real estate offices. In my opinion, I don't believe that it's necessary there. But places where it's impossible to social distance, where you're walking up and down grocery store aisles, if this is going to happen, I believe it should be where places where it's difficult at best to try to socially distance from other people, not outside and not in regular places of business that are not places where people, they have customers coming and going out of that place. I don't think it would be necessary there. So, and if I guess I'll let people, I have some other information from other people, but I don't want to monopolize the
Councilmember
conversation.
Thomasoff, this is exactly the discussion that I'm looking for.
Okay.
But I'd like you to elaborate just a little bit more. So, for instance, the restaurants, obviously you can't wear a mask as you're eating, so would your suggestion be that we require servers and cooks to wear the mask and patrons as they walk in and walk out, but not as they're eating?
Exactly.
That's the feedback that I'm really looking for from all of you.
Exactly.
Please.
Yeah, and I saw a sign somewhere that cities were, I don't remember where I saw it, I wish I would have saved it. I looked for it and I couldn't find it. That cities are saying, basically, restaurants are putting up signs saying, you know, when you're free to have your mask off when you're at your table because the tables are socially distant. So, you know, obviously you can't eat with a mask on, so you would be able to remove the mask, you know, while you're at your table. But, I mean, obviously, we're at a point now where it cannot be ignored that the virus is widespread in our community. And I guess since I still have the floor, I'm going to say that you shared something this morning that was from the Arizona Medical Association, and their email said that there were a consensus among nearly 4,000 Arizona physicians that they represent that preventative measures like physical distancing and mask wearing when distancing is not possible, and those are the CDC guidelines, and good hygiene are critically important to slowing the spread of the virus. They, again, Arizona Medical Association, they say masks are used to protect others from what you are breathing out. They are not detrimental to the health of the wearer. And that's some of the arguments, at least myself, that I've been hearing from other people, is the idea of the mask is to keep the spittle, and if you've seen the videos, probably by now we all have, when people are talking, you can't see it unless you use lasers and other things to look at it. There is spittle flying when people talk, and that presents a danger. The letter that was sent to Governor Ducey had 908 signatures of people that are healthcare professionals. This Arizona Medical Association, 4,000 healthcare professionals. Mayo Clinic is saying cloth masks can help reduce the spread. I reached out to, we have Midwestern University here in our clinic, and I reached out to the president of the university yesterday. And I just want to read, not the entire email, but Dr. Geppinger says, I would respectfully request that you establish a policy in the city of Glendale that requires the use of a face mask in public. I am saddened that we appear to be in a new phase of COVID-19 journey here in our state, and any action we take to reduce the spread of the pandemic is greatly appreciated. So my point is, I don't believe this is a political issue. I don't know how it's become a political issue. I think it's a public health issue, and we should be listening to the healthcare professionals when we make a decision about this. So that's all I have for now.
Mayor.
Good.
Thank you. And I will echo what I believe I was hearing Councilmember Tomachoff say, and that is, I'll say for myself, that I'm disappointed in the resolution that was presented for consideration. I'm disappointed that staff time and resources were spent drafting that instead of digging deeper into what are the facts of the situation and what is being done in our peer communities here in the Valley, and to break down what are the elements of a ordinance or a proclamation that should be included in such a thing if that's going to happen, so that we can better discuss how we as a council would feel about it. I've taken the liberty of finding and sending to all of the council members and key staff the actual proclamations from Scottsdale, Avondale, Tolleson, and Tempe, the 4 cities in which the mayors, to the best of my knowledge, the 4 cities here in the valley, peer cities of ours that we use all the time, have in their proclamations. There's a lot of commonality through them. There's some differences. I happen to think that the Scottsdale and the Avondale ones would fit our community the best, and there's a lot of different elements in there that are discussed that might be worthy of us discussing. And I wish that we had, in essence, a matrix like we always get on questions like this of what are the issues and how are our peer cities dealing with them on a point-by-point basis. But not having that, we'll deal with what we do have. I will say that after a lot of study and after having read a lot of emails and Facebook comments and newspaper stories, I've reached the conclusion that it is absolutely the best thing for our community to require masks in public, but not every public place. But I certainly do believe that in our restaurants, the servers and the patrons, except while they're seated at their table, should be wearing masks. I believe in our retail locations, such as our grocery stores and similar doctor's offices and all similar places, that masks should be required, and that the business owners should understand what the rules are and that they're held accountable for it, as well as their customers. And but again, these particularly these two, the Scottsdale and Avondale proclamations, I think would fit our community quite well, and they are comprehensive and discuss the issues. The one thing that we haven't heard today is, at least I haven't, is exactly the testing is one thing, and people will say, well, of course, the more testing you do, the more cases you're going to find. The percentage of positives is an important data point in the testing, and our testing is finding an increasing percentage of positives. That's decent data. It could be who we're testing that would be doing that. But the really critical, hard to disagree with element is what is happening in our hospitals. And the number of patients whose symptoms are so severe that they need to be hospitalized, many of them in the intensive care unit, many of those on ventilators, is going up dramatically. We are leading, we're not just leading the nation. Well, and our zip codes aren't just leading the state, my zip code being one of those, but Arizona is not just leading the nation, we're leading the world in the increase here. And we need to do something about it for our residents. We're coming off of a 4-week experiment of what happens if we open up the economy and we don't require face masks. And the results are clear. The number of infections go up, and it begins to affect a broader spectrum of our population. This is no longer just something that's hitting the elderly the hardest or whatever. The current increase in patients seems to be the greatest, I believe, between 25 and 45. It's otherwise healthy young people. And it's probably related to the degree of interacting in the community that they're doing. They're out more, they're interacting more, and they're not taking even the simplest of precautions like wearing a face mask. This is like the bottom of what you can do. Wear a face mask. They're not expensive, they're free in many places. You can make your own. It can be as simple as a bandana or a torn off piece of a t-shirt, but wear a mask to keep from spreading it, whether you think you're sick or not, because you don't know. So we have, I think, a very serious public health problem in Glendale, in metropolitan Phoenix, and we need to act. And every day we waste is only causing more people to be infected, which will mean more people will be hospitalized, which means more people will be in the ICU on ventilators and will pass away from this disease if we don't do something and don't do it soon, and I don't think we have time to waste. Thank you.
Councilmember Clark.
Thank you, Mayor. Councilmember Turner talked about hospitalizations, and I would like further information about that. of course, we're seeing a rise in the number of COVID cases because we're all doing more extensive testing. But how does that translate into what is happening in our hospitals? Is the rate of hospitalization and ventilator use increasing as well?
I'm back on. Mayor, Councilmember Clark, it is.
Okay. I think that's the important point. As we test more, obviously there are going to be more COVID cases, but I think we do it, as has been expressed nationally, and the phrase is used, flatten the curve, because we don't want to overburden our hospital system. We want to be able to provide care to those that need it without having to turn people away. And I think that's a very important point to keep in mind. I'm also going to say, make a couple of comments. I really am, I guess, philosophically, one of those live free or die people. I hate wearing this mask, and yet I've done it religiously every time I go out in public. And the point is, I'm not doing it for me. I'm doing it for my family. I'm doing it for others, so that should I contract the COVID and say I'm asymptomatic, I'm not passing it on, hopefully with the use of a mask, and I'm using gloves, and people have told me it's dumb to use gloves, but I'm going to use gloves anyhow because it makes me feel better. The point is you're not doing it for you. And you can only be so selfish so long before you realize that you have to protect others around you and you have to protect society. And I think right now Arizona is an embarrassment to the nation because our spike has gotten so high, so fast, and is so prolonged. We need to do something about this. And one of our responsibilities is to protect the public's health and safety. So whether I personally think that everybody should wear masks or not is irrelevant. I have to think in terms of the general safety of the public. I support mandatory mask wearing, but that's with a caveat. I don't think people necessarily have to wear masks outdoors. When you're, as Councilmember Tomachoff said, when you're hiking, running, exercising, walking your dog, washing your car, whatever it is, you don't need to be wearing a mask. And it looks like, sadly, the protests are proving that, because the initial data from the massive protests that have occurred in Minneapolis have been that there is no spike in COVID cases as a result of those protests. At least that's the initial information that we have to date. So I am not in favor of mandating the mandatory wearing of masks outdoors. Indoors is another matter. And I think the criteria should be this. If you cannot socially distance, you should be wearing a mask. If you are going to be in contact with people, as was stated, I believe, by Mr. St. John, for 10 minutes or greater, you should be wearing a mask. As for children, children provide the lowest instance of COVID-related cases. I would hate to be a mother and try and get a mask on a 2-year-old and have them wear it for more than 5 minutes. It is difficult, if not impossible. I would at least consider 6 or above, although I think even that may be too young. But if children are going to be mandated to have to wear masks, it should be at an age when kids understand what's going on. And I don't think a 2-year-old has any concept of what's going on. So despite my personal beliefs I will support mandatory face coverings indoors when social distancing is not possible and when you will be in contact with people in an enclosed space for more than 10 minutes. As for the resolution, the only thing I had hoped that we would do today was this council would vote on either supporting the mandatory wearing or not with whatever guidelines we wish to present to the mayor, and that we vote to give the mayor direction to issue a proclamation. And I think that should be the ultimate result of this meeting. Thank you, Mayor.
Mr. Milner.
Thank you, Mayor. I've received quite a large number of emails and phone calls on the issue, and it is a very dividing issue for our city. Slightly more than half of the responses have been against doing any kind of mandatory, and a little under half have been in favor of a mandatory. The first question I have, and a lot of the questions or concerns came in, that the wearing of face masks, the ones that we are wearing, the non N95 type masks, which majority of the public are wearing, do some have some positive effects, but scientifically, have we seen, and I'm going to ask our staff to respond to this, what does the scientific evidence say about wearing the mask and the negative effects of wearing a mask?
You got it.
Mayor and council. They're still collecting a lot of the data out there. And the data we do see and the recommendations we do see change quite often, as you've seen. They go back and forth. Do the mask work? What level of mask? Council member brought up a good point that Clark and Council member Tomachoff, that really you're protecting the sputum coming out of your mouth is the main reason to wear a mask. So the data is changing quickly. It's opinionated. I don't think there is any hard data that says so many people are dying because they wear the mask and so many people are dying because they don't wear the mask. But the main thing they're after is the sputum control, and that has been proven that it does.
And that's kind of the breakdown that I've been getting from my residents is, are we really making a difference with the mask? And they read the scientific evidence, and it has changed. It keeps changing, and it's even changing as of today. You know, and it depends on who you're speaking to and what scientific backup they have. And so I am concerned about that inconsistency in our science, not even knowing for sure that it is making an impact. I have received many emails that of individuals who become ill, that they have tried wearing a mask and they become ill. And some of these people are at-risk groups, and they have chosen to avoid going out into public too much in order to prevent them possibly catching the COVID virus. So how do we address that? And again, I'm providing input to the mayor on this. We must address that issue. We can't just mandate that the public, everybody, wear a mask. There's exceptions, and we talked about children already, but there's exceptions also for adults. And I think we must take that into account in whatever decision we make. You know, the memo that Councilmember Tomachoff brought up, specifically from the Medical Association, specifically said where social distancing is not available. And so I think we need to remember that we still have to protect individual rights along the cause of protecting us I think one resident said it very well. They said, government's responsibility is to protect my rights. That's what government is here to do, is to protect my rights. And is mandatory, without any exceptions or mandatory at all, is it protecting individuals' rights? And there is strong argument that we are protecting your health. We're protecting you from the possibility of getting ill. Is that the role of government? I'm not here to say it is or isn't, but there are concerns in the public that that is not the role of government. And I think we need to take into account those issues as we move forward on this process. You know, one thing that I've had discussions about is, you know, businesses are in business, and I think I agree with what was stated earlier, I believe it was Councilmember Aldama, that we cannot afford to shut down our business again as an economy. We cannot. I just don't believe that's the right way to go, and I agree with that. But do we allow the businesses to make part of that decision? Is it the business's role and job to ensure that they have safe procedures in place to protect their clients? And I think any business you talk to would say, yes, I think that's what we should be doing. And maybe we should be giving direction to the businesses to, this is what you need to be doing as a business, is setting up some sort of standard to ensure, and I know the CDC and the governor, they've come out with certain rules and regulations, and many businesses are following them, but some are not. And I just wonder if maybe we're mandating to the public something that we should be, you know, looking more towards the businesses to ask them to put into place a better process for avoiding the spread of the virus. Regardless of what the mayor decides today, I will support the mayor's decision regarding this. I just believe there's a lot of concern out there for personal liberties that we need to take into account. We need to take into account those who cannot or don't want to, because of physical reasons, wear a mask. And we need to make sure that the regulations are directed towards helping our businesses retain their customers and to protect them as well. And I may have some other things later, but that's what I'd say at this point. Thank you.
Thank you.
Mayor, could I respond to that?
Good.
Thank you. I respectfully, Councilmember Miller, I disagree with some of that. I don't see any difference here than a ban on texting and driving. I mean, that was a pretty controversial issue as well, but I don't believe a person has the right to endanger others. And I think that's what we're really talking about here, is whether people have the right to endanger others. And finally, the texting bill was passed, because that is really what the ultimate conversation was about, is it a right to text and drive? Not if it endangers other people. So, and I believe that that's what we're talking about here, is that the idea is there are, and we're all aware, there are asymptomatic carriers all over the place that people, they say, if you're sick, stay home. Well, that only works if you're sick or if you know you've been exposed. It doesn't work if you're asymptomatic, and that is, from everything I've read, where a lot of this is happening, is there are people that don't know that they have the virus, they feel fine, they're carriers, and they're spreading the virus in the community. So there's no way to combat this by saying if you're sick, stay home, because it doesn't work if people are asymptomatic, or if you've been exposed 2 days ago and don't have any symptoms yet, and you're going about your business, you don't know that you've been exposed. So I respect your opinion, but I think that really what the question is here is, do people have the right to endanger others? And it's the seatbelt law. I mean, I haven't heard anybody say that, mandatory seatbelts are unconstitutional or a violation of somebody's civil liberties. It's a safety issue. So it's unfortunate that we're in this situation. Nobody wants to have to make a decision like this. I don't like having to make a decision like this. I don't think we need to vote on it because, as I said earlier, I believe the the charter is quite clear, we've never voted on the declaration of an emergency. We haven't voted on a single issue with anything to do with COVID up to this point, because the charter is clear whose responsibility it is. I hope the mayor issues a proclamation. I hope he does it sooner rather than later. This is a public health emergency that we're experiencing right now. The recommendation from our emergency operations team is to recommend face coverings and social distancing. The medical experts recommend the same thing. So I disagree with the fact that part of somebody's civil liberties is to endanger others. I don't think that that's, in my belief, that that's the case. Thank you.
Mayor?
Go ahead.
Thank you, Mayor. So first of all, I'm happy to hear that the proclamation is not on the table and it's removed. We all know what Councilmember Tomachoff just said, that the decision is with you, and I've known that to be. So it's a great democracy that we get to have the input for our communities, as you suggested earlier, and give them to you, and you'll make that ultimate decision. So to you, what I'm saying to you is what hasn't yet, and I'll be answering some of the emails with my comments now to those who text me and call me. This is not like the flu. We know nothing about COVID-19. I don't believe we know much more today than we did when we first heard about it. I think scientists know a little bit more about it, but that's not made public. So we know one thing, that PPE does help in stopping the spread. I do like what Councilmember Clark said earlier about she asked a question about, is there more of a use of ventilators in hospitals today than before? And the answer is yes. What hasn't been mentioned is when the ventilators fail, unfortunately, is the ECMO machine. That's a very rare piece of equipment that's used to save lives with regard to the flu. But that's being used. I'm being told that all hospitals have those deployed, and not every hospital has them. There's a very few amount. So if we can do something that will assure the spread is minimized, then I think we would be serving our citizens very, very well. So again, I'm going to state what I stated in the beginning. Mayor, you should come out with a mandate of some sort, but has exemptions that the council just mentioned. I think that all of us have stated before publicly that we want to support our public safety with resources and tools. I think this is one resource and tool that they need the most, but they too would need and require some type of exemption. So I am in favor of some type of mandated face mask. Thank you, Mayor.
Thank you. Mr. Hugh.
Thank you, Mayor. A lot of great discussions. Councilmember Clark mentioned quite a few exemptions. She was talking about when a mask would be required. And I know we have represented the police department with our deputy manager out there. Are they going to go out and enforce face masks in the public, or?
Mayor, Councilmember Hugh, the recommendation from the governor is to do enforcement through education. Many cities are taking that stance, and if education doesn't work, then they're requiring a certain level of supervision on site before any other enforcement action is taken.
Thank you. I too have been polling my district, and the majority is leaning they do not want to be dictated by the government, infringing on their liberties, a mandatory face mask. And I can understand that. But the way we're talking right now, there's so many exemptions. And I see people driving their own car and they have gloves and masks on, and it's just one person in the car, and I always wondered why they're suited up that way. It doesn't sound like we'd be looking at mandatory all the time. You're seeing any place in the city of Glendale having to have a mask on. There seems like there's plenty of exemptions. I know Ray polled his district, and mine and his probably polled pretty much the same way. Mayor, I know it's your decision, and it's tough, but we have, it looks like plenty of exemptions going on that will allow people their freedoms also. I know it's going to be a hard choice for you to do, Mayor, but with, I think, the rest of the council, whatever you come up with, we will support you. Thank you.
Thank you. Go ahead.
Just a couple of points, and I am anxious to hear from the public that's out there, but just to follow up on a couple of comments. I don't think that the scientific evidence necessarily has changed. I think that we're gathering more evidence. I know that the CDC recommendations changed from weeks and weeks ago when there was a shortage of PPE and we didn't have masks and our supply chain had broken down. The CDC at that time was not recommending that people wear manufactured masks, that be saved for our hospitals and first responders. But now that masks are in supply and now that homemade masks are available, that hasn't been the CDC recommendation for a long time. I believe the CDC says that it is better to wear a mask and to prevent the spread of this disease than it is to not. Now, there's some discussion about the N95 mask, which is not what the proclamations that have occurred here in the Valley deal with. That's a different specialized mask with a special purpose. There may be public safety places for that. There's certainly in hospital environments, there are times in which that N95 mask is appropriate. But even in the hospitals, I don't think they're wearing the N95 all of the time. There's also some current conversation about the N95s with the exhaust port. And that's why the N95 is not recommended, certainly with the exhaust port, isn't recommended for the general public because it allows the free exhalation. That's for when you're in a contaminated environment. But what we're talking about is a mask to prevent the spread from people who may be contaminated and not know it to others. So that N95 mask. So it's not a contradiction to say that wearing a face mask like this, or like what Councilmember Clark is wearing, or like many of the people in this room here are wearing, it's not a contradiction to say, yes, that is good advice, but not necessarily to go to the N95s. As far as the public input, my email, and I've got probably in the neighborhood of 50 or so, and these are unsolicited emails. I didn't go polling people I knew in my district or people who are on my email list already. This is unsolicited emails are running 2-to-1 in favor of us, the city of Glendale, requiring masks in public spaces. The comments that I've seen on the Facebook posts that I put up informing them of this meeting run even more in favor of it, but that could be skewed based on the people who subscribe to they're friends of mine on Facebook or who they share it with or that sort of thing. So the key to me is that if I'm gauging the opinion of my community, these unsolicited emails are telling me 2-to-1 they want us to pass a face mask requirement. Certainly with the emergency proclamation by the governor and then later by the mayor, it's clear that the mayor has the power to do this, but there's nothing in those proclamations that take away the power of the city council to deal with it as well. And it would be a much more timely process for us to do it as an entire council. But that's why I want the mayor to act and to act quickly, because I think every day counts. I've just got a message here reminding me that Banner ERs, I'm told that last night Banner ERs had no beds, at least the one in Glendale had no beds available because of this COVID situation. This is a health emergency. And I lean at times almost libertarian. I do believe that less government is more, but some places we need government. And protecting public safety is an area, and protecting public health is an area. This is a public health issue, and it needs to be dealt by the public body that can deal with it. I believe that government closest to the people is best, and whenever we can do that, and I think at the city level, it's the time and it's the place, and we have the power to do it, and I think it needs to be done. Thank you.
Thank you.
Mayor,
Go ahead.
one more. I'm getting about, and I talked to you yesterday about this too, and I think you were getting about 70% of the people I'm hearing from are asking us to do this. So, I mean, I realize it's a controversial issue, and I just also wanted to mention that while we were meeting, Phoenix scaled back their emergency to a level 2, where they have more than one level of emergency in Phoenix, so they did vote, and they adopted, and I just read their exceptions. I think their exceptions are very good. And Gilbert also adopted. So, I mean, it's just, it's an unfortunate situation, as I said earlier, to be in this situation, but I feel like we have to act, and I agree with Councilmember Turner that every day, creates more danger for everyone else. It's unfortunate that people could be infected and not know it, but that's how this is spreading. It's not spreading by people. If you're sick with this, you're too sick to be out. It's people who've been exposed and aren't sick yet, or people who are asymptomatic. That's how this is getting spread, and that's where these cloth masks will help. Thank you.
Mayor?
Okay.
A couple of things. I am not ignoring what I too have received in emails and phone calls and Facebook, and overwhelmingly, they support the use of masks. And Vice Mayor referred to elderly people who may have chronic conditions. I did receive a couple of emails that specifically referred to having, for example, asthma. And they said that wearing masks for them was very difficult, if not impossible, because of their chronic breathing conditions. So I think there do have to be exceptions for those who have some kind of chronic illness that makes the wearing of masks worse, not better for them. I also would say this, people refer to science. I don't think anybody believes the scientists anymore these days.
Can't hear you.
Pardon?
Pull your microphone in front of your mouth.
It is on.
Better.
Okay. I don't think people believe scientists anymore these days. Remember a couple of weeks ago, all of a sudden the CDC said, oh, guess what? You don't get it from touching surfaces. Within 24 hours, they reversed that and said, oops, we made a mistake. You do get it from touching surfaces. I think we have to go with our gut instinct on this in terms of viewing this in terms of the best interests of the general public. And from what I'm hearing from everybody is, yes, we all believe in individual rights, civil liberties, but I also would remind everybody that this is not going to go on forever. At least, God, I hope it doesn't go on forever. It will end. And I had thought about it driving over. Do we want to mandate a timeline and how long this mandatory mask wearing would go on? And I thought about it, and I thought, well, there's really no way to determine what the deadline is. It's got to be based upon fact, what we see in Arizona. When we see a decline in cases, that's what would tell me that maybe the mandatory wearing of masks is no longer as critical as it is right now. So, Mayor, I would hope that you would issue a proclamation as soon as you and staff can get it together with a list of exemptions that we have all voiced, and let's start protecting the public. Thank you.
Thank you. All right, we're going to go to public comment.
Here, I have one more comment, if I may.
Go ahead.
I agree with Councilmember Clark to a certain degree that the timing, I think we do need to have timing. And I disagree that we can't put a time limit on it. I think everything that has been done by the government to date on these type of mandatory things has had a time limit. And I think we should have some sort of time limit. I don't know if that's 30 days, 60 days, or 90 days, but whatever the mayor decides to do here, I believe we need to have some limits on it. And I would hope that we can take a compromise position and whatever the proclamation states that it is, that takes into concerns the items that I have brought up in the face of the many people, a compromise in favor of some parts of our I guess, what we'd call the concerns of liberty. I think we need to take into account some of those things, and we need to have a time frame. And the enforcement, I think we need to recognize that this is a voluntary enforcement, as stated through education. There will be no police action, and I think that needs to be stated. Thank you, Mayor.
Okay, with that, Daniel McCarthy, I'm going to have you speak first. And then following Daniel, if you'll wait in the hall, Paul Bronson, if you'll be standing in the hallway ready to go. Mr. McCarthy, you have 5 minutes, sir. If we can stick to just this subject, okay?
You got it.
Thank you.
Thank you for the opportunity to speak. My name is Daniel McCarthy. I'm running for United States Senate currently. I have unique access to information, which I'm going to share a few things with you guys, that none of which have been said. So I ask all of you to pay particular attention to what I'm about to say, please. The governor of our state on April 23rd, this is April 23rd, said, and I quote, "It wouldn't surprise me one bit if I had this in December or January. Think about the amount of people at the Phoenix Open that likely had it and recovered." That was April 23rd. On April 7th, Dr. Brex, and I quote, "We have taken a more liberal approach to mortality." This is from the WHO guidelines. Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms like a fever or a cough. Oh, here's another one for you. Could someone please ask why whistleblowers are coming to me? Because they're afraid to speak out. Because they're going to lose their pension, they're going to lose their retirement if they speak out. And they're telling us this. They have 50,000 tests in the state of Arizona, positive tests.
Mr. McCarthy, we can hear you fine. I need you to lower it down.
I am going to lower it down. This is not the government's responsibility to tell people to cover their face and tell them they can't breathe. Tell my 16-year-old son in America, Jerry, we need you to step up as a leader. We need you. This is nonsense. It's been over 100 days. Let me go on, please. Please pay attention, please. In November was the first reported case. In November. They gave us math, simple math. I'm a CEO. I manage tens of millions of dollars. Math is easy. The government gave us math. They said every person on average is going to spread it to 3 people. The first case was in November. So every 5 days, people present symptoms. November, first case. 5 days later, it goes to 3. 5 days later, it goes to 9. 5 days later, it goes to 27, right? It's simple math. Under those calculations, right now, I'm sorry, in February, there would have been half the world's population. This is in February 25th, according to the math that they gave us. Math! No emotions. Half of the world's population would have been...
Sir, I can hear you. We have microphones. Lower it down, please.
There's no sense in lowering it down.
There is. I'm going to ask you...
Listen, you put our police officers in situations
Mr.
now...
McCarthy, stop for a second. Push the microphone away from you. You're hurting my ears. Just push the microphone away from you. Just push it away from you, and then go ahead and talk. Perfect. Go ahead.
You guys are putting our police officers in positions, yet again, to confront the public in a way that is absolutely irresponsible. You are going to make these poor people want to quit, and I don't blame them. Don't tell me there's not more going on here. There's more. This is a violation of the First Amendment of our country. You cannot tell someone, they have to wear a mask. That is a God-given right. Shame on anyone for thinking you, as a council person for the city of Glendale, have a right to tell somebody that they have to cover their face. Shame on you. You're being scared. This is not America. We don't fear. Guys, this is from the WHO. There's over 200 plus or minus pandemics a year. Every year. Are we going to live like this forever? Is this the America you want to raise your kids and grandkids in? That every time a virus comes up, we scare them into oblivion to not living? We have risk every day. I've seen two people in Flagstaff on a bike 20 feet away from each other with masks on. Insanity. Let me repeat what I said. The basic math that the government gave us, starting from the first case, if you multiply it by 3 every 5 days, over half the world's population by the middle of March, before the shutdowns, would have been infected. In over 100 days.
5 minutes.
Jerry.
Time?
I
Wrap
know
it
my
up,
time's
please.
I know my time's up. Jerry, I've been a supporter of yours. Lauren, and shame on, I remember when Lauren was independent and trying to convince her to run as a Republican. Shame on me.
Okay, I do need you to wrap it up, sir.
Jerry.
Sir, I need you to wrap it up, please.
I'm going to wrap it up. I've supported you. I've done the so we appreciate public service. I am doing this now. Please, pay particular attention to what I said.
Thank you. Thank you. Mr. Bronson, and then if Adam,
And by the way,
excuse me.
This shouldn't end.
Adam Danks or Banks, I
Shame on you
can't
guys.
make your writing. You'll be up next. You'll wait in the hallway. For the record, sir, if you'd state your name, what district you live in, if it's Glendale, if not, the city you live in, and then you have 5 minutes.
Okay, thank you. My name is Paul Bronson, and to be honest with you, I'm not sure what district of Glendale I live.
Just give us your crossroads.
The main crossroad is 83rd and Glendale.
Okay, that'd be Yucca District.
My house backs up to the Desert Mirage.
Okay, you're in Yucca District. Very good. Go ahead, sir.
I appreciate the fervor of the prior speaker. I'm not going to yell at you. I don't support a government mandating this type of thing. And the reason I don't mainly is because we don't know for sure what we're dealing with. We're sitting in a room with those who are going to make this decision about whether you're going to mandate masks for the city of Glendale, and I see 2 masks. You're not wearing a mask. You may have one, but you're not wearing one. So do you really believe it's effective or not? I look at the OSHA requirements for businesses about face masks, and what they say is the only real face mask that works very well is the N94 mask, the respirator. And those have to be fitted, and you have to be trained, and you have to be monitored, and you have to have all kinds of different situations in order for it to be 100% effective. Otherwise, the masks aren't that effective. I hear you talk about the need to keep the sputum for people who are asymptomatic. Do asymptomatic people spread the disease? Because I've been told several different things on that from the supposed experts. Do we know for sure? The other question I have is the spike that we've had in the cases in this area. We just came out of a 100-day lockdown. How many of those cases were from people who stayed at home? Are they contracting it at home? Do we know? Do we have enough information to be able to make this kind of a determination and this kind of a decision that will affect the population of Glendale City? I've heard council people bring up, we have seatbelt laws, we have laws against texting. Yeah, we passed those laws and they're still in effect. They're still in effect today. There was actual data that proved that if we that these things, there's a correlation there. I don't think there's enough consensus on data. There's not enough legitimately to warrant making this kind of a decision. And if you make this decision and you don't have a sunset clause on it, how long are you going to put it in place? Is it going to end up being like the seatbelt laws, like the texting laws? It's just another law that's on the books. And what enforcement are you going to attach to this? Are you going to put people in prison? Are you going to fine people if they're not wearing a mask? These are things that you need to have these decisions made before you make this kind of a proclamation and enforce this kind of a law or an ordinance on the people of the city of Glendale. If you don't make these decisions, then what are we supposed to do as citizens? This has nothing to do with the merits of wearing a mask, legitimately. I think it's probably a good idea, especially if you have symptoms. But I don't think it's the government's duty to impose this on its citizenry, especially an open-ended proclamation like you're discussing. That's all I have. Thanks.
Thank you, Jim. Okay, Mr. Danks, and then Joan Abney, you're up next. If you can wait in the hallway, be ready to go. Again, if you'd state the district that you live in, if you know it. If not, your crossroads and your name, sir. You have 5 minutes.
My name's Adam Danks. I'm a small business owner in downtown Glendale. Actually live just steps away from this building in Catlin Court District. I'm here today opposing a mandate for masks. In 1865, on this day, a man in Texas proclaimed to everyone that people are free. It's surprising that in 2020, I have to come to my local government and request, please reaffirm that truth, that we are free individuals. Please respect the sovereignty of individuals to do with their person as they choose. I think we're looking too myopically at the fact that this is a exploding small issue. I think we're looking at this as an individual piece. I think we need to think more broadly. As soon as we start implementing policies as a government that impact and take away abilities for our citizens to decide for themselves what they will and won't do, we've overstepped our boundaries. We can't do this in the name of safety. The human condition is not safe. We have risks inherently because we are living beings. You will never put a policy in place that makes everyone 100% safe. So to try to suggest that a policy of mask wearing does that is patently false. In addition to that, we also would be quite hypocritical if we didn't respect the lives of all other cases of things that kill people that we still choose to allow people to do. We sell cigarettes on every single street corner, even though we know that those are dangerous. They kill people, and not just the people using them, people around them from secondhand smoke as well. We still drive vehicles, even though 1.3 million people per year die in vehicle accidents. So implementing a policy that creates the necessity for someone to give up their right to use their body to wear a mask or not wear a mask based on their own sovereign decision for their individual person is not appropriate. That's my position. I want to be explicit in the fact that I don't have a problem with a business or an individual choosing for themselves what they would prefer to do. If a business says, Costco for instance says, we're not going to let people in if you don't wear a mask. That's Costco's decision. They will reap the benefits or pay the consequences for their decision. I, as an individual, have the right to decide, do I want to do that and go in, or am I against that? I don't want to wear the mask, and therefore I'll find somewhere else to buy my goods. That is the process that should be allowed to happen. That allows the natural selection of which things will prosper and which will not, based on the decisions of the individuals in your community, not based on a top-down mandate for what will and won't be accepted. So my request is please use the authority that you've been granted to support the sovereignty of individuals in your community.
Thank you for your comments, sir. Joan Abney, you're next, and then Joe Garcia, if you'll be in the hallway ready to go. Again, if you'll state the district that you're from, you have 5 minutes. Thank you.
My name is Joan Abney. I'm from the Cactus.
I do need you to speak into the microphone. I can barely hear you.
Cactus District. I
You-
actually,
Go ahead and pull it down. There you go.
let's see if I can do it. Look in my way. I came here with two things to talk about, but listening to the meeting, I was originally under the impression that this was going to be a people comment, you guys get together, you have your vote, and so I thought I was inputting into a vote on a very specific part of whatever's in this thing. Listening to your earlier conversation, you took me in a whole new direction, and I don't know that I have enough time here. But I do want to clarify a couple things that I picked up from the conversation. Asymptomatic, they keep telling us now, they're not running around making people sick. The seatbelts and the texting laws are state laws. I think we all had a little bit more input into those. It's kind of not a good equivalency. Somebody made reference to a 4-week experiment. But our lockdown was, we were released from lockdown, I think, from public pressure and from numbers that just weren't adding up. This did not turn out to be what we thought it was going to be. It wasn't anybody's fault, but it was nice that somebody acknowledged the fact that, oh, we could have been wrong. But it wasn't an experiment, and I keep hearing this underlying subtle threat that if we don't comply, if we don't fall in line, if we don't do whatever it is that's going to be in this resolution, we could be looking at another lockdown. I think that would be citywide, and I think that would be a city decision, but I don't think that that's on the horizon for the state. And it's a little uncomfortable listening to that. That's not what I expected when I got here today. Let's see. Food services. You want to put a mask on a waitress? Anybody that votes for that never waited tables. Just give it some thought. The mask thing itself. We keep hearing about the herd immunity. It really is a real thing. It's what we all grew up with. I can look at almost all of you, and I know that this is what we grew up with. And we're blocking that. We're sending people back out in the public, and then we're going to tell them, oh, but don't breathe into the air. But where do you think our immune system comes from? I mean, we're picking this stuff up as we go along. That's the way we were built. There's got to be some thought for that. I don't want to be mean here, but I don't care what Phoenix does. I moved to Glendale. I moved to Glendale almost 30 years ago. I picked Glendale. I didn't pick Phoenix, I didn't pick Tempe, I didn't pick Mesa. What they do is up to them, but I don't understand this, what sounds like a need to comply or to go along or to be part of a bigger community. I mean, I understand being good neighbors, but Phoenix is being driven politically. And I think that there's a little bit of a bully in an office there that kind of takes on Tempe and Mesa on occasion. And then somebody had asked about, what was it? They were asking, I had brought with me, that would have gone along with what I was really concerned about, a New England Journal of Medicine article. And about masks in general, okay? And I was going to use that with other things I was talking about, but somebody had asked about data. I don't know that there is really any data, but this is from the New England Journal of Medicine, and it says, we know that wearing a mask outside healthcare facilities offers little. We know, is what they say. It offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic, not asymptomatic, COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19...
5 minutes.
Go ahead and wrap that up.
The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is reflective reaction to anxiety over the pandemic. Okay, so that's
Okay.
what they're saying about this.
All right, your
And
time is up, ma'am.
I understand that, and I do apologize, but I have to throw this one last thing in there.
Please.
No one, nowhere I go does anybody address our seniors. We have a whole population that are locked away. We're not seeing them. We don't know them. We are the only protection for them. Without your eyes on them, that's what keeps them safe.
Thank you.
You need to be our voice to get those people released from prison. And I apologize for not getting, but I don't want to wear a mask, and no offense to law enforcement, but I won't.
Thank you.
So.
Thank you. Joe Garcia. Mr. Garcia? Okay. And as a reminder, if you'll tell everybody the district you live in, if you know it, if it's Glendale, if not, give us the crossroads, please.
Guys, my name is Joe Garcia from the Yucca District.
From where, sir?
The Yucca District.
Okay, very good, thank you.
And I wrote, "It is with a troubled heart that I come before this board. I had hoped and prayed that our governor would lead by example, taking the reins of leadership by mandating a statewide mandatory mask policy. Now that burden falls on each city within Arizona, diminishing the power and the ability that a unified response would have provided in the face of the COVID-19 pandemic. Here today, a piece of that burden has fallen on the city of Glendale Council. It is an opportunity to lead by example and be a beacon of light for Glendale citizens and Arizona as a whole. I come addressing the council with the Center from the Disease Control Guidelines that I'm sure the council is aware of. Nevertheless, I'm advocating on behalf of my district, family, and brothers and sisters of humanity with simple facts to shed light before the council votes. For the Center of CDC, and I quote, "The virus that causes the COVID-19 spreads mainly from one person through respiratory droplets, coughing, sneezing, and talking. Recent studies show that the people who are infected but do not have symptoms likely also play a role in the spread of COVID-19. End quote. This alone makes it clear why face masks should be mandatory and enclosed spaces and social distancing should be mandated. To combat COVID spreading, the CDC states, and I quote again, wear cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as grocery stores, pharmacies, and gas stations. Cloth face coverings may slow the spread of the virus and help people who may have the virus do not know it before it's transmitted to others." End quote. According to a peer-reviewed article, 25 to 50% of the COVID-19 people are asymptomatic, with the CDC stating approximately 35%. And per our 2019 census data, shows that 61% of Glendale's population was in the ages between 18 and 65, with 20% of them in the ages of 45 to 64. This demographic is at the highest risk to contract and spread the virus. In addition, paramedics and police should also be mandated to wear these masks, protecting the ones they're in contact with, as well as themselves. Per a recent report that I know many of you have already mentioned by Arizona Central, quote, "Inpatient beds occupancy was already at 83% of the normal availability, and ICU beds statewide were at 80% occupancy, according to the Arizona Department of Health Services data. The true account of the current bed capacity shortage has not even materialized, as aforementioned statistics account for all patients, including those not affected by COVID already. So COVID-19 cases have doubled since Memorial Day, when the restrictions were lessened, as the chart you showed for the Arizona Department of Health. This should give cause for concern. A rise in the cases which is currently occurring in our state surely will affect bed capacity and the ability to treat patients. Adding to that problem is that there is insufficient staff. This will strain hospital resources, the workers, and the life-saving ventilators that you guys have already mentioned. Now it is a time to mitigate preventative mask wearing and not act with folly later in a reactive manner. These short but powerful statistics and scientific experts should suffice for mandating this preventative protocol. But if not for science, then for the sake of God and faith that many in our state, as well as some of the council, proclaim to follow. Any familiar with Jesus or Christianity are familiar with the core principles that are common to many and well known. Love thy neighbor as thyself. This is a commandment for believers, rooted in New and Old Testament doctrine. If the board chooses to dismiss either of these aforementioned reasons, that I would see the council not acting in behalf of the best interests of its citizens, whom we all have pledged to serve. Love in actions, not in words, as is James chapter 2 says in the Bible. In closing, for the Arizona Revised Statutes 38-231, the oath of office that is required states to defend all enemies, foreign and domestic, sworn before God. This would include domestic citizens, quote, that do not know better, lacking the ability to discern what is best for the city. I pray the council does not lack this insight and make the correct judgment for the constituents and lead by example through this ordeal. You know, people had mentioned this, the role of government. Everyone knows in the Constitution, in the preamble, it says to promote the general welfare. That's what you guys are doing right now. So that is the government's role. And when they said the facts about face masks, there's no data. Everyone knows that masks prevent the spread of infectious diseases. I think that's pretty much since the time of infectious disease when people were wearing masks. So this isn't something specifically has to be towards COVID. Thank you all. Thank you for your time. I pray you all make the right decision.
Thank you for your comments, sir. I have no other speaker cards. With that, I do want to thank everyone for your input today. The COVID-19 global pandemic has caused all of us to think about and consider policy issues that we never could have ever imagined. I want to thank our emergency management team for bringing a recommendation forward to us, as well as all of your time in the last months to ensure the safety of our employees and citizens is paramount. Based on this discussion, I'll immediately begin to develop a proclamation regarding face masks, which I'll issue by the end of today. A key component to addressing health issues is knowledge and education, and that seems to be one of the biggest components to the arguments, is that it seems to be so many differing opinions from experts across the board. With that said, regardless of my decision today, I beg each of you to continue to do what you can to mitigate the spread of the virus that you can have without knowing. And I know that none of us want to be the reason that loved ones become ill or in fact die. Until that order is issued, I'm strongly encouraging everyone, please, please, social distance with the 6 foot is imperative. Wash your hands as often and at least for 20 seconds. Sanitize surfaces often and use hand sanitizer, and refrain from touching your face. And that's probably the biggest problem I have, is I have a tendency of, anyway. With that said, I will render a decision this afternoon, and I want to thank everybody for attending. I appreciate all of your comments and your concerns. With that, we're adjourned.